This is a review video of $3,000 Thai hair transplant. Was this a mistake? From the channel More Best Ever Food Review Show by Sunnyside, as we commonly know him. In this video, we are going to discuss his medical problem, his hair loss problem, how the surgery was planned, how he chose a clinic, our opinion about how his hair transplant has been performed. Please do subscribe to our channel to keep on watching such informative and useful videos. So let us first see what he says about his medical problem.
I know people might think I was losing my hair a lot over time, but even if you go back to 10, 12 years ago, I always had a bit of a widow's peak right here. And then the hairline didn't move back much. I just was losing density of my hair everywhere. For a long time, I was starting to hate the way it looked on camera because I wear a bandana because a bandana is cool.
So here he describes his medical problem. This transplant was performed around 2 years back. Since 12 years before that, he was having his hair loss problem, and he was quite conscious because being a social media influencer and a media personality, he was concerned about his bald areas showing up on the sides even after wearing a bandana.
The problem is that when I would wear the bandana, you would just always see this skin part right up here, and it really bothered me. I would try to maybe make the bandana thicker or push it up more, and it just looked weirder and weirder.
And this receding hairline was the problem why, he wanted to undergo a hair transplant.
Until one day, a friend who has been on this show, who I will not reveal, told me that he had gotten a hair transplant in Thailand. And he said it was pretty cheap, actually. The place I went, it cost $3,000. $3,000 for a procedure that lasts a lifetime. I can't believe it. This is something I never would have researched for myself, but since my friend did it and he had good results, I thought, you know what, I'm going to Thailand.
Then he saw one of his friends who had undertaken a hair transplant from a clinic from Thailand. He saw good results from that clinic for his friend, and then he also decided to explore this option. Most probably, he's suffering from a Norwood male pattern baldness grade 2 to grade 3. This is the point when he wanted to have a hair transplant and wanted to fill up his sides so that he looks better on camera than what he looks before the hair transplant. So he went to a clinic in which his friend has got a hair transplant done already, and when he went there, let's see how his consultation went along.
You sit down with the doctor and they tell you a bunch of things that you maybe should have researched before that moment, which I didn't. First, they said there are a bunch of things that can go wrong. Your head can reject the hairs. You can have this hair shock syndrome where a bunch of your hair falls out. And the weirdest thing is because they are transplanting your hair, if you don't take the special pills, you could end up keeping the hair in front that they transplanted and losing the rest of the hair behind it.
So on recommendation of his friend and after watching his results, he went to the clinic in Thailand, and the first thing he did was consultation. And it's very important for you to have a consultation and never ever directly go for a hair transplant with any doctor or any clinic. And in his video, he has shared his feedback about the consultation. He says that he did not do a lot of research, but we request you to do a lot of research before actually undergoing a procedure. In his case, the good thing which we found out was that the doctor explained to him both the positive and the negative aspects of hair transplant.
What throws people off is that after a few weeks, most of the hair they transplanted falls out. Oh yes, this is a long-term commitment. They told me your hair is going to be looking good and ideal in 12 to 18 months.
They were not very pushy, not very salesy kind of people. So this is a very good sign of a good clinic or a doctor. And they told him what can go wrong, which only an ethical doctor would do or an ethical clinic would do. They would discuss all the aspects, the positive ones and the negative ones. This is a very crucial thing which you should also be discussing, what can actually go wrong and what are the policies of the doctor or the clinic if the things actually go wrong post-procedure. And they also emphasize the importance of taking long-term medical treatment to prevent further hair loss, because there is a recession of the hairline on both the sides. His angles have deepened just by a single hair transplant, and not taking medicines can cause hair loss in the middle area. In the future, he can have hairs on the sides and this area being empty. And now we are seeing a lot of patients coming with this kind of problem who underwent a hair transplant of the sides, did not take medicines, and this thing became bald. Friends, taking medical treatment is in the best interest of you only, and this was duly discussed. Also, he mentioned that hair transplant is a long-term commitment. So this is absolutely right. No single procedure can ever solve your entire hair loss problems forever. No hair transplant can do that. And if you have some unrealistic expectation, if you want to know that whether hair transplant is good for you or not, what are the reasons which we feel you should never undergo a hair transplant, we have already made a video on that, and you can watch those 10 important reasons in terms of expectations and other factors why you should not have a hair transplant. You can watch the video on the link given above. Now coming to the procedure, the first first thing he shows is the hairline marking, which you can see on the screen. So we can see that the hairline has been marked sort of a perfect way in his case. It's not straight, it is irregular, and there need to be micro and macro irregularities in a good hairline. It's going gently towards, curving towards the back. Some temple points are also filled here. So in our opinion, the hairline which has been designed in his case is almost absolutely perfect. Coming to the procedure, the first step he describes is the hole punching, as we can see in his video. This hole punching is basically slit making, and there are a lot of devices to make these slits. These slits are the tiny gaps where the grafts or the follicular units are actually placed during a hair transplant procedure, and we can again see that the work is quite neat. This is done after making the area numb by giving local anesthesia. The slits are made quite dense and irregularly irregular, not in parallel lines which look like a railroad. So again, this work in our opinion looks to be very neat and perfectly executed. The next step which he has shown in his video is the hair extraction, and you can see that this is being done by FUE technique in this case by using a motorized device. This is typically FUE, where low torque or a low rotation speed machine and the handpiece along with the punch is used to extract grafts slightly apart so that the area does not become totally depleted. And here we can see that there are some shots showing the grafts being extracted in a proper way, then collected and or sort of taken out and capped for further insertion. So good. This is a good work again. The only thing is these are not hairs, they are follicular units or grafts. Each of the follicular unit or the graft can have 1 to 4 hairs in general. Hair is a single hair and a bunch of hairs is known as follicular unit or grafts or roots as we know in the layman terms. Here we have also been told that 2,800 follicular units were extracted in his case.
There's 2,800 to be specific, and then we're going to put all those hairs.
Now coming to the next step, that is hair implant. And we can see that the doctor is implanting the grafts or the follicular units into the slits which have already been made using the implanter pen devices. These are sort of pen-shaped devices which have a side slit where the roots are loaded. Then the doctor himself along with his team is inserting those follicular units into the slits which have already been made. So there are two ways in which the implanter pen insertion is done. One is when no slits have been made and the grafts are inserted using the implanter pen themselves without any pre-made slits, and the angle and direction is kept in mind while doing that step at the same step. And the other method is the dull needle implanter technique method, where the slits are already made in a proper angle and direction, and then the hair transplant doctor is inserting the grafts into the slits which are pre-made. So this technique was described by Dr. Mauro Spirenzini from Brazil in 2016, and this is what we also do in our practice. This is how we also do a lot of implantation along with the other methods also which we do, and the decision is based on a lot of factors. We do the forceps implantation as well as the implanter pen insertion, and the density which is being shown at the end of the procedure looks to be very good. I think this step has been done. These are the basic 3 steps during the surgical procedure. One is the slit making, graft extraction and the graft insertion. We can see that there are some comments about redness and the duration of the procedure being around 11 hours as you can see in the video.
Roughly 11 hours since I got here, and it's finally over. He said it went well overall. Be careful.
Now on the day 2 it is shown that there is some swelling on the forehead. The patient has gone for the after wash on the day 2 to the clinic, showing some swelling which is quite expected, and this is again a sort of a reactionary swelling after a surgery, especially on the head and neck and face. He has been given a bonnet to wear to protect his hair. This is a very good idea. Although you can wear a cap also, like a baseball cap or a loose cap, without actually rubbing on the transplanted hairs. That is also a good option for you if you want to sort of not let people know that you have got a hair transplant done. He is demonstrated how to wash his hair after the transplant. So this is a very standard protocol from good clinics, that they let you know how to take care of your transplant at your home, because you can't be there for a long time if you're especially going out of your own country for a hair transplant. You also need to take care of your own transplanted area, how to wash it, how to protect it from any trauma. So these are the kind of normal standard post-procedure instructions being passed on to the patient or told to him how to take care of that. Also in the post-procedure part, he has been given instruction not to do excessive exercises or drinking for 2 months. So every clinic have their own protocol. In our clinic, we have sort of a restraint period for around 2 weeks or so, 12 to 15 days. We don't want the patient to do excessive gymming or exercises or drink a lot of heavy alcohol content. So you can do the things in a moderate amount, but not too much. That can actually cause some damage to the transplanted hair post-procedure. In the video, he has also shown that he had excessive sun exposure when he went to travel to Mongolia, and he had some shedding of the hairs when he went to Indonesia. So you should avoid sun exposure if you have a sensitive skin or very fair skin for around 4 to 6 weeks. Shedding is very normal, as we all know that shedding starts around 10 to 14 days post-procedure. It can vary. The duration or the time interval at which the shedding starts can vary from person to person, and the amount of shedding also varies, and this can continue for 2 to 3 months. Then the growth starts. So this is quite what is expected from the hair transplant. And then at 4 months, we have seen that he has got a growth in the hairs, and this growth looks perfectly normal and good considering that this is just 4 months. So post-transplant, new growth keeps on happening for 12 months or even above, sometimes up to 15 or even 18 months at times. If you do not see final results at 3 to 4 months, please don't be disappointed, because we all know when the hairs start growing, they keep on growing for a very long time. All of the transplanted hairs are not going to bloom out at once, third or the fourth month. They just keep on coming and coming. The only thing you have to do is keep on following the instructions which your clinic has given. In the end, he describes the importance of taking medicines to prevent further hair loss. So we all know that it's a common knowledge that minoxidil and finasteride are the US FDA approved drugs to prevent further hair loss, and it is well recommended for people who are more concerned about the ongoing hair loss rather than regrowing the hairs in the area which you have totally become bald. Also, he gives an option to keep your hair bald, a scalp bald, if you have an advanced degree of hair transplant, or if you're not too inclined about undergoing a hair transplant and want to keep your hairs totally buzz cut. Another option which you can check out in the link is the scalp micropigmentation, which also works well, especially if you want to keep your head totally shaved. So that again is a good option. If you are also planning similar kind of hair transplant, you can call us at the numbers given here, or you can write down in the comment section below, and we will try to reach out to you with the solution for your hair loss problem. So what's our take on this hair transplant? I think the consultation was perfect. The doctor we checked out, he's a ABHRS doctor, an American Board of Hair Restoration Surgery Diplomate, and this is the highest certification in the field of hair transplant. The planning was good and it was executed perfectly, and for around 2,800 graft, the charges, as the title says, is around $3,000. So it's quite cost effective for the kind of work, and at 4 months we have seen that the growth or the results of hair transplant also look very promising and very good. So if we have to give a rating to this hair transplant, we would rate it perfect hair transplant 10 out of 10. So that's our take on it. If you want to know the cost of hair transplant, please click the video on the left, and if you want to see any of our hair transplant testimonials, please click the video on the right.